Let's have a look at the case study, and the case study being the some road safety measures that have been taken in Victoria as a way of addressing what is probably one of the highest causes of years of life lost in Australia, especially in that 18 to 25-year-old age group. So, a case study of road measures in Victoria. Now, the background to this is that in the 1970s, the, the deaths and injury um, caused by motor vehicle accidents was quite substantial in the 1970s. It's still substantial, but um, there's been some progress made, and basically a comprehensive uh, health promoting approach based on settings was initiated. Um, Now, over this time, the the there's been a decrease in motor vehicle accidents, fatal motor vehicle accidents, notwithstanding the fact that in fact there's more cars on the road and also the cars are travelling longer distances. So it's actually quite a substantial difference. But let's have a look at some of the actions that have been put in place in relation to the Ottawa Charter. So if we look at firstly the actions in terms of building healthy public policy, we can see that there is an extensive amount of collaboration between different stakeholder groups. So whether it be insurers, police, car manufacturers and government. And in fact, new laws were introduced related to seatbelt wearing, speaking, using a mobile phone when you're driving, etc., etc. Also, the drink driving legislation was enhanced, and I think there might have been a drop from the point .08 to the point .05 as a limit, for example. Also, speeding legislation. I know that recently there have been reduction from 60 kilometres an hour to 50 or 40 kilometres an hour in residential areas. A lot of basically policing and enforcing regulations, because you'd realise that having laws don't work unless you enforce them. So random breath tests, a lot of speed cameras, and now there's some other types of testing. Seatbelt legislation is one area that has developed over that time, making sure that cars are safe. Although this is not necessarily the case in some states. And also making sure people don't get too intoxicated. So now there's a level of governance about who can serve alcohol to whom. If we then move on to the creating supportive environments, so if the roads are better, there are less black spots. You can see better because there's better road lighting. Cars are in better condition. The communication about the downside, the consequences of actually doing something silly in a car, giving people alternatives, because people are still going to go out and they're still going to socialise and they're still going to want to have a drink. So having low alcohol alternatives so people can still engage in their social activities, but they become less dangerous to themselves and others. And also being able to base all this activity on evidence. The third element, strengthening community action, actually getting the community involved in governments through various councils. So we have maybe cycling groups, parent groups, integration with police and also local government. Giving people alternatives to driving cars. So if people are intoxicated or tired or whatever, they can take public transport. It's an option, and also it's affordable. Examples like creating a walking school bus program, and what this does is it basically say you've got a school here and you've got various homes around the neighbourhood. Basically, parents are quite nervous about letting their children walk to school on their own. Therefore, they'll drive children to school, which adds potential for accidents to happen. So the idea of a walking school bus program is walking to school is coordinated, so it's sort of like a virtual bus where people, groups of students go from one house to the other to collect students, and then they all walk to school together, which puts less cars on the road around schools where a lot of accidents can occur. So the fourth element, developing personal skills. So improving not only driver skills, but also a very structured learn to driver program. So for example, in Australia now, you're required to do 100 to 120 hours of logged driving prior to being able to go for a license. Education's about bike riders because a lot of accidents are actually caused by cars hitting bikes, and also educating people, particularly students, but also others in the community about the consequences of driving under the influence of alcohol. Fifth element, reorienting health services, quicker responses to road accidents, because some people, from the time that they're injured to the time they actually get to hospital, is quite a critical time, and if there's no intervention in between, there's more chance of dying. So medical associations become involved, road trauma teams participate in media campaigns so that you can actually talk to people who have to deal with the consequences of drink driving, and it's quite a traumatic experience for them, and also speed limit reduction in appropriate areas. So these are all examples of the types of strategies that could be incorporated into each of those 5 elements of the Ottawa Charter. And you can see that all those elements rely on some sort of setting to be implemented in. Now, the question to be asked is, okay, we've got these upstream and downstream factors, and the Traffic Accident Commission, which drives all these ads that you might see on television, certainly in Victoria. I mean, they're good and they have an impact, but in isolation, would they work? And the answer is probably to a certain extent, but certainly not to an extent that would give a good return on investment. So in combination with these ad campaigns, there's a whole range of other campaigns which need to be implemented, and specifically looking at upstream factors related to legislation and policy, which facilitate the uptake of the messages communicated in these ads. So it's important to note that TV ads or pamphlets or other pieces of information, firstly, won't work in isolation, but secondly, it's the return on dollars. Individual television campaigns are very expensive, and the return from the dollars is pretty marginal. So another way to look at this is to look for conflict between different stakeholders. So sometimes, and you know, there are classic examples of upstream factors not working against downstream factors. So, for example, if we're looking at road safety, it doesn't make sense to have a car that might go 250 kilometers an hour at the maximum speed when the speed limit is only 110. There's no point to this. So, and not only that, having a car that is able to exceed those speed limits means that some people will. So in this case, the upstream determinants are out of sync with downstream determinants. We're telling people to go less than 110 kilometers here, but we're building a car that might go faster than 250 kilometers per hour. So there are a range of other um, factors. For example, if we're telling people don't smoke, but cigarettes are readily available, there's a conflict between these two policy levels. And when we think about this, we think about, okay, the advertising, for example, the advertising campaigns of the Transport Accident Commission are TV ads. They're all downstream. They're trying to address the issue closer to the consumer. But if we don't have appropriate upstream policy changes, then downstream interventions will be more difficult to see some change in. Now, the question here of does society not want to improve their health outcomes? The majority of the society values health, wants to be healthy. However, in certain situations, there's a real conflict between health and other imperatives. And the problem with health, of course, is that you've got an exposure here, and over a long period of time, eventually that leads to some sort of health outcome. And usually people are thinking in the moment and living in the moment. This is one of the challenges with prevention, that people tend not to think that far ahead. Why do upstream interventions have more impact than downstream interventions? I think the key word here is sustainability. Also, upstream factors tend to focus more on population rather than individuals. And why can downstream interventions be labelled as silo interventions? That's because silo means it's very restricted rather than broad community. It's actually restricted in one particular area. And again, it's this issue of individual versus community or population. Now, is victim blaming advantageous in the pursuit of positive health outcomes? The problem with victim blaming is that it basically focuses on the downstream factors, and so again, it's only got limited possibility of success because it's downstream, but it addresses individuals rather than populations. So this is one of the problems with victim blaming.